Hello, I'm Beth Wagner. Welcome to Movement and Function. Today I'm going to show you McKenzie extension exercises for low back pain. These are great for pain that's located just in the low back or lumbar spine, also pain that is in the buttocks, down both legs, or just down one leg. Also, if there's numbness, tingling, or weakness down one leg, that is originating from the lumbar spine or low back. Now, before we begin, I just want to explain a little bit about why these exercises are called McKenzie extension exercises. Now, the McKenzie method is actually an evaluation and treatment technique. Its current name is mechanical diagnosis and therapy, but it's more commonly known as McKenzie. Now, the specific exercises in a McKenzie program are based on the results of the evaluation. Now, because so many people have responded well to lumbar extension, those are the movements that have become most commonly known as McKenzie exercises. That's what I'm going to be showing you today. Now, I've already posted a video that goes through a self-assessment technique that mirrors the McKenzie method of evaluation. If you're interested in performing the self-evaluation, click the link down below. It's a longer process and it provides a lot of great information that will help you determine the best possible movements for your back. This video is an abbreviated version where I'm going to jump right into the lumbar extension exercises. The primary exercise that's commonly known as the McKenzie lumbar extension exercise is a prone press-up. I'll be doing this one lying on my stomach. All right, lying on your stomach, place your hands palms down right next to your shoulders. Inhale to prepare, and as you exhale, press up, letting your low back and your belly relax, using your arms to push you up. At the top, pause, come back down. Inhale to prepare. Exhale as you press up. When you get to the top, let your belly sag to accentuate the stretch even more. And then go ahead and lower. Again, inhale, and as you exhale, press up, let your belly sag, and lower. Make sure that you keep your abdominals and your low back muscles nice and relaxed as you perform the press up. Perform 10 repetitions every 1 to 2 hours. Inhale, exhale, press up. Pause, let your belly sag. And then lower. Inhale, exhale, press up. Now, if this is feeling really good and you want to try a hold, pause in this position for up to about 5 seconds or so and see how that feels. Sometimes that's really helpful for achieving longer lasting pain relief. And lower down. Now, another option for sustained extension is to hang out in this position on your stomach, on your elbows. Be sure that your abdominals and your lumbar spine muscles are relaxed, and make sure that you're pressing down through your elbows, keeping your shoulders away from your ears. You don't want to let your shoulders sink into your ears like that. Keep your shoulder blades down and back, and pressing down into the table or into the surface with your elbows. Stay in this position for anywhere from 1 to 5 minutes. This can be a great position to try out working on your phone or using some other device for a few minutes at a time to get a really great break from sitting. As you maintain this position, especially if you start adding in other tasks, be sure that you're still paying attention to how your back feels. Make sure that you don't overdo this position and end up with more symptoms in your low back or running down your leg. So the key is to check in now and then, see how your back and your lower body are feeling. Now, if you have pain all on one side, a helpful tweak with the press-up is to move your hips off-center. So if I have pain in my left leg, then I'm going to move my trunk over to the left and then perform the press up. Palms down right next to my shoulders, and inhale to prepare, and then exhale, press up, let the belly sag, and then lower. Inhale, and exhale, press up, keeping your shoulders over to the left. Your hips, relatively speaking, will be over to the right. Pause, let your belly sag, and then lower again. Now see which way it feels better, to stay midline or to move your hips off center. If you get better relief from the pain or other symptoms down your leg with doing it hips off center, continue 10 repetitions. The next time you go to perform the exercise, try it midline again. See if you get relief midline. If not, return to doing it hips off center. But every time, start in midline and see how you feel before doing it hips off center. At the point where you get good relief from doing it in the midline, then you don't have to perform it with your hips off center anymore. Perform 10 repetitions every 1 to 2 hours. Since getting onto your stomach several times throughout the day might not be very practical for you, depending on your lifestyle, what you do for work, and your daily activities, I'll show you an alternative method of achieving lumbar extension standing up. Standing with tall posture with your feet a little wider than hips distance apart. Lift your chest, relax the shoulders down and back, and do a little bit of a chin tuck. Now, before you do the extension, get as tall as you can. Think of a string coming out of the top of your head and pull gently on that string to elongate your spine and get as much space between the vertebrae as you can. Bring your hands to the base of your hips just above your buttocks. Inhale to prepare, and as you exhale, lean back and continue going as far as you feel comfortable. Pause and come back up to the starting position. Inhale again. As you exhale, lean back. Go as far as you can, pause, and come back up. Continue at a smooth, slow pace. Inhaling to start, exhaling as you bend back. And come back up. All right, continue 10 repetitions as long as you are feeling a reduction in pain and/or feeling the pain, numbness, tingling, weakness, whatever your symptoms are, moving up from your leg or the most distant point away from your back, up towards your back. One of the key components of successful pain relief with McKenzie Exercises is that any pain you have down the leg will come back up towards your spine. So if the pain that's farthest away from your back is located in your foot, that pain should march from your foot up towards your knee, up towards your hips, and finally towards your back, and then go away. If at any point in time the pain travels farther away from your back, stop these exercises right away. That is an indication of things getting worse instead of better. Now, sometimes along the way, pain can intensify in the lumbar spine. Now, if that happens while pain, numbness, tingling, or weakness, whatever your symptoms are, if those symptoms are also coming up away from your leg and back into your back, that is a good sign temporarily. So that increase in pain in your lumbar spine associated with the symptoms moving up towards your back is a temporary sign of improvement, and it will go away as you continue performing these exercises. At no point in time should numbness, tingling, or weakness get worse down your leg. So continue up to 10 repetitions as long as your symptoms are improving, meaning that any pain you have in your leg or legs is moving up towards your back, and the pain in your back is decreasing. Continue these extension exercises every 1 to 2 hours. As your pain begins to decrease day by day, then decrease that frequency to every 4 or 5 hours, and then finally twice a day. For most people, twice a day is a great maintenance program. So once in the morning and once in the evening, 10 repetitions, whether that be the prone press up or the standing extension. Now, if you find that you're doing well and you start to have breakthrough pain, meaning you've been doing great, your pain's gone, and then maybe there's a new activity you do, or you've spent too much time sitting, or whatever the case might be, and pain comes back, increase the frequency of the extension exercise. You might need to go back to once every couple of hours again for a day or two until pain subsides, and then again decrease the frequency back to twice a day for maintenance. Another couple things to consider in your recovery is your rest position and your posture. So you can do all of the McKenzie exercises you want, but as long as you continue to sit slouched or spend too much time sitting, bending forward, driving in a slouched position, pain will continue to come back. So be sure that you're using adequate lumbar support. Sometimes a small decorator type pillow works really well to take up the space of the natural arch in your low back. That can be really handy in work chairs, on the couch, and in the car. Play around with some different supports and pillows and things to maintain good upright posture. Check out some of my other videos on posture and positioning and work ergonomics if you want to learn more about some different ways that you can improve your posture and feel better overall. Sleep position is also a really important component to relieving back pain. I've posted a video on sleep position and pillow support, so check that out for further information. As long as your back is responding well to these repeated extension movements, there are a couple things to keep in mind for an overall exercise program. I recommend walking or treadmill, something upright for cardiovascular conditioning. I don't recommend biking because of the curved position in the back inherent in cycling. I also recommend waiting to return to running and weightlifting for at least 2 weeks after your pain subsides. Now for core exercises, it depends on what you're doing for core. Sit-ups, I definitely recommend waiting at least a month after your pain is completely gone before you go back to doing sit-ups. For other core exercises like planks, you can start to incorporate some of those in as soon as your pain subsides. A strong core is obviously very important for maintaining a healthy back, but if you start doing those exercises too soon, you could experience setbacks in your recovery. So wait until your pain is subsided before returning to those exercises. I hope you find these exercises helpful for alleviating your back pain and any other symptoms you have resulting from an injury in your back. If you like this video, please give it a thumbs up and consider subscribing to my channel. Here's to your healing, health, and happiness. Have a wonderful day.